I'm Marc Mani. I'm a plastic surgeon in Beverly Hills, California. I did all my training at Baylor College of Medicine in Houston, and I am a facelift specialist. My practice in Beverly Hills in the beginning was based on things I learned during residency, and I made a real effort over time to learn and accumulate more and more knowledge, and also to maintain the cutting edge of facelift surgery. One example of that is something I started doing about 8 years ago, which is a scarless or endoscopic deep plane facelift. I switched from a 2-layer bilamellar facelift to a deep plane facelift, and I wrote one of the seminal articles about why that was a better idea. That was published back in 2016. But the latest thing that I found is that I was frustrated with doing facelifts and not improving the skin. You know, if you try to pull a face so tight that you're going to get rid of all the fine lines, the patient is going to look ridiculous. So you don't want to do that, and facelift surgery is really a deeper structural operation done the best way it can anyway. So I found that regenerative medicine, and particularly Nanofat, has been a real boon to my practice and more importantly to my patients. I have an interest in regenerative medicine in general because this is really the forefront of rejuvenation. You know, surgery's been done for a long time, but regenerative medicine has been done only for the past, let's say, really 10, 12 years in earnest. So it's something that's really advancing and there's science behind it. I'm not a fan of filler. I think too much filler is done, and regenerative medicine, Nanofat, dovetails quite well with doing fat transfer and natural autologous volume addition. So I love everything about it, and one of the things I've tried to do is just keep myself educated and be on the forefront of things, and also thought through the best ways and tweaks and pearls, as I call it, of how to deliver the Nanofat. I think there's different ways to layer it that make more sense, and so that's the thing I've tried to develop. The effectiveness of Nanofat, the fact that we knew Nanofat was going to be effective, is all based on our experience with fat transfer improving the skin. And this is how a lot of these things develop. It's not in the lab, but it's in the lab that we are working in with our patients. And you don't want to experiment too much without having science behind it, but at the same time, you're injecting autologous tissue, autologous cells, so you know that that's going to be safe as long as the technique is safe. One of the things that I do is I do this under local anesthesia, and one of the doctors was asking me after the session, do I do it under local, what's the comfort level? It's extremely easy to harvest fat under local anesthesia. A lot of people do full liposuction under local anesthesia, and it's really not hard at all. We just give oral, Xanax, and the patients are fine. We can make sure they're pretty relaxed. It's very rare. I would say I could count on 2 fingers the patients that I've had to take to the operating room when I'm just doing fat transfer and Nanofat. I also do it during surgery though. If I'm doing a facelift, I don't want to compromise the result, so I'm always going to do Nanofat during the surgery. I do it at the very end of the surgery. I also add an energy-based device. I used to use Morpheus 8. I use Potenza now to create microinjuries that help activate the stem cells. And I use the Potenza fusion tip to infuse the stem cells. But it's not, I take my time. I don't want to do things fast and rush through. I don't have a high volume practice because I want to see results and take care of the patient afterwards. So I use the fusion tip, but I also use a tangential injection, just like Dr. Ternard and Verpali have done for a decade or more. And I use a 27 gauge needle, and I inject about 30 cc's if we're doing the face and neck. So it's a lot of quantity. You have to do it in the right layer, but it's also layering of first the microinjuries with radio frequency devices to activate the stem cells, and then on top of that the tangential injection, which is intradermal primarily, maybe a little bit in the superficial subcutaneous tissue, and then more superficially even into the epidermis is driving that fluid in, driving the cells in with the fusion device, or a mesogun or whatever you're going to be able to use. And there's other devices that are coming out that I'm going to explore as well. Patients are very pleased with fat transfer and Nanofat. The impression that they have is that it's easy, the recovery is easy. I tell patients that they're pretty much reliably going to be ready for a Zoom meeting. If we do it on a Friday, by Monday they'll be fine. The main drawback recovery-wise, especially in LA for people that like to exercise twice a day, is the fact that they have to have fat harvested, so they can't do strenuous exercise, but that only lasts about a week. So, and as someone that doesn't like filler, I found this to be a great substitute. It's not that much of a compromise of your lifestyle. And patients come to me looking for facelifts. I'm a facelift surgeon. But at the same time, that's a very emotional decision for patients to come and say they want to have a facelift, because a facelift sounds like you're really old, and it's too late. But what I have found is that this is sort of a way for them to get their feet wet. They do something in the office under local anesthesia. I also combine this with upper blepharoplasty, and that can be done under local as well. So anything I can do awake, I do. I didn't like to do it in the past, so let's say 10 years ago, but now I love it because it's an easy way to segue into larger procedures. And most importantly, it really works. You know, makeup is harmful to the skin. I remember my mother was a Southern lady, and she used to cake on the makeup, and underneath that was just, you know, her skin had a lot of pock marks and blemishes. And I was convinced that it was because of all the makeup she was wearing. But Molly's right, the makeup, the patients afterwards, they look better with or without makeup because the skin is so smooth. So you're putting, you know, paint or whatever you want to call it on a smooth surface, where if you try to paint stucco, it's going to be harder, it's not going to work. And that's basically what you're doing with skin blemishes and irregularities. But pores shrink, so the makeup's not getting into and clogging as many pores, and it's just smoother and better hydrated afterwards. To say that results last longer with Nanofat is an understatement, because the results are essentially permanent, because as I tell patients, you're creating a change in the cellular milieu of the skin. You're literally rejuvenating the skin, you're making the skin younger. And I think one of the things that happens, aside from the proven fact that you can reverse sun damage and you also create new blood supply with new parasites in the cells, the new cells that form, you're also adding moisture to the skin and doing things that last, and it keeps working again and again. I do find that when patients have Nanofat one session in the office and then they happen to decide they want a facelift, I do another session about 2 to 3 to 4 months later, the effects are additive. But when patients ask how long this lasts, I tell them that they may want to have another procedure within a year or two, but it's not so much that it's gone away, it's that will build on what they have initially. So one of the slides that I showed, which was melasma, that patient got better and better over 2 years. And one of the things I didn't point out about the acne scarring patient, which was the first one I did, she was a friend of a friend, she had tried everything and obviously nothing worked. This really worked, but it didn't start working for 6 to 12 months. And so you're disappointed at first, but once you know, you can reassure them it's going to keep working and they really have something to look forward to. I do a lot of work with Face Forward International. I'm the director of their medical advisory board, and I perform the majority of their surgeries. It's a charity that delivers surgical reconstruction for victims of domestic abuse, any sort of violence, terrorism around the world, and they fly patients to LA. A good percentage of them have had acid burns, and it can burn the entire face. Patients go blind, the nose kind of disappears because this is really strong acid. And so I've done forehead flap reconstructions of noses and ocular reconstruction, which we have specialists for. But the Nanofat has been instrumental in making their skin more soft and getting rid of a lot of the burn damage. And doing stem cell injections is really the only option for this type of burned skin. It has to be done in a regenerative way. And so that's proof positive that it really works for some more severe injuries. And we had one of the patients who was a victim of mistaken identity in the UK who had acid poured on his face because someone knocked on his door and thought he was the person that was cheating with his wife. And he's become very famous as an exponent against domestic violence and against this type of thing. But the important thing that he told me is that he was finally able to go out in the sun without his skin blistering and really becoming vulnerable to skin cancer. And he's able to enjoy the sun more because of the reversal of the sun damage. So that's another area that's been really important in also. Well, you know, I always those are difficult cases, and reconstructive surgery is generally less satisfying because you can never take someone from looking really, really deformed or needing something to looking totally normal. But at the same time, this is an option that we never had before, and it really does work. So yes, we've seen great results. We tend to repeat the treatments, but we do that in cosmetic patients also. So we've definitely seen results that we were happy with. The charity reconstruction is about 10% of my practice, and every single case I do Nanofat on because they almost all have burns or scars. We had a young lady who was injured pretty severely in that explosion in Beirut that happened when that material exploded on the harbor, and a television exploded all over her body, and she was shrapnel glass, and she almost bled to death. And she came in for Nanofat, and she's seen a significant difference. She had little hyperpigmentation scars all over her body. But so about 10% of my practice, most of the patients have burns, so it's a significant part of my practice.